Hi, my name is Dhanalakshmi. I am studying M.Sc Nursing first year. Now I am going to discuss about the community health nursing topic, that is nothing but national health goals. National health goals are also can be converted as Millennium Development Goals. These are all Millennium Development Goals are can be having strategies. Some of the goals, national health goals, including every 4 years the health goals will be conducted. Coming to the national health goals, the national health policy in 2002 will attempt to set out a new policy. National health goals and Millennium Development goals are also can be discussed in this. Let us we will see what are all the national health goals. The National Health Policy 2002 will attempt to set out a new policy framework for the accelerated achievement of public health goals in socio-economic circumstances currently prevailing in country. National health goals are as follows: eradication of polio and AIDS by 2005, achieve zero-level growth of HIV and AIDS by 2007, reduce infant mortality rate to 30, at least 30 by for every 1,000 live births by 2010, increase use of public health facilities to more than 75,000 by 2010, increase governmental health expenditure from the current 0.9% to 2% of GDP by 2010, elimination of leprosy by 2005. These are all the national goals are as follows. Next one is the special laws. As a child are most vulnerable part of the society and can be easily targeted in India, we have enacted many laws and acts related to children in order to protect them and to give them better and sound development. Continuational provisions, permeable or permeable commitment, justice, liberty, equality for all citizens, including children, are main purpose of Constitution. In this equality before laws and equal protection of laws, empower the state to make the special legal provision for the children. It makes government to ensure child's welfare constitutionally. Free and compulsory education for all children in the age group of 6 to 14 years. Put total ban on forced labor and is punishable under the Act. Provide protection for the children in Act like the Factories Act 1948, the Child Labour Act in 1986, the Child Marriage Restraint Act in 1986, Juvenile Justice Act in 2000. Like this, so many acts were established. Reduction of mortality by 50% on account of tuberculosis and malaria, other vector and waterborne diseases. Reduced prevalence of blindness to 0.5% by 2010. Establishment of integrated system of surveillance, national health accounts and health statistics by 2007. Increased share of central grants to constitute at least 25% of total health spending by 2010. Increased state sector health spending by 2005 from 5% to 7% of this budget. Next, coming to the Millennium Development Goals, sir, what we have seen, that is all national health goals. Now we will see the Millennium Development Goals, nothing but MDG goals. Introduction. The Millennium Declaration made during the United Nations Millennium Summit on 8th September, which was conducted on 8th September in 2000 year, was signed by 189 countries, including 147 heads of the states and governments, and included 8 goals called the Millennium Development Goals. Why we are calling means, here the states, all 147 states and together 189 countries are coming here and putting some goals, that is nothing but called as Millennium Development Goals. MDGs and related targets and indicators provide a framework for planning policy interventions and benchmarks to monitor progress in human development and poverty reduction. This is the Millennium Development Goals, how it was established. Next, 18 strategies were set as quantitative benchmarks for attaining the 8 MDGs. What are all they? The United Nations Development Group, in its second guidance note endorsed in 2003 year on country reporting on the Millennium Development Goals, provided a framework of 53 indicators which are categorized according to targets for measuring the progress towards the individual targets. These are all the MDG goals targets. India's MDGs framework is as per the UNDG's 2003 framework for monitoring of the 8 MDGs. Out of the 18 targets, 12 targets are relevant to India. Corresponding to the 12 strategies, there are 35 identified indicators. In these indicators, already we have discussed, that is most recently these changes made in MDGs configuration is the inclusion of specific target on reproductive health. In MDG 5th goal, what they set means, achieve by 2015 universal access to reproductive health, improving maternal health and complements in its original targets and indicators. These are all the 5th indicator. Coming to the Millennium Development Goals, 8 goals for 2015 are eradicate extreme poverty and hunger, improvement of mental health or maternal health, achieve universal primary education, promote gender equality and empower women, education, reduce child mortality rate, combat HIV, AIDS, malaria and other diseases, ensure environmental sustainability, develop a global partnership for development. These are all the 8 goals for setting by 2015, which can be reached in the year of 2015. The MDG goals framework is, goal 1 is the eradicate extreme poverty and hunger. In this mainly the eradication of extreme poverty, hunger we are setting as a goal. Next one is the into 1990 and 2015 they are setting a goal is prevalence of underweight of children and under 5 years. Under 5 years, that is nothing but taking the malnutrition children. Prevalence of underweight children under 3 years of age group. They are taking both 3 years age group, under 5 years. 2 age groups they have taken for to eradication of poverty and illiteracy. Next, goal 3 is the promote gender equality and empower women education. Okay, in this eliminate gender disparity in primary, that means gender equality, not only male child, female child also should educate. That disparity is called. And secondary education, that means intermediate board, preferably by 2005 and in all levels of education no later than 2015. This is nothing but goal 3 is education, disparity of gender equality. There is no difference between the boys and girls in the education, even in the primary and secondary also. Coming to the goal 4 is the reduce child mortality rate. Child mortality must be reduced by 2015 itself. Next, target 5 is the reduce by 2/3 between 1990 and 2015. The under 5 mortality rate should be reduced. Next one is the goal 5 is improve maternal health. Target 6 is nothing but reduced by 3/4 between 1990 and 2050 the maternal mortality ratio. Next, goal 6 is the combat HIV, AIDS, malaria and other diseases. In this, target 7 is the have halted by 2015 and began to reverse the spread of HIV and AIDS. That means what are all the HIV AIDS prevalence cases of mainly HIV cases between the age group of both men and women, mainly pregnant women between 15 to 24 years have taken for the HIV prevalence and incidence. Coming to the goal 7 is the ensure environmental sustainability. Target 9 is the integrate the principle of sustainable development into country policies and programs and reverse the loss of environmental resources. That means regain of environmental resources. Coming to the target 10, half by 2015 the proportion of people without sustainable access to safe drinking water and basic sanitation of the water, pure water can be provided by the year of 2015. That is the target 10. In this sanitation, they are given mostly important. Target 11 is the by 2020 to have achieved a significant improvement in the lives of at least 100 million slum dwellers. In this, goal 8 is develop a global partnership for development. In this, target 12 to 17 are not relevant for India. They have taken for the other states. That means 12 to 17 targets were not kept for India country. Next, target 18 is in cooperation with the private sector make available for the benefits of new technologies, especially information and communication, mainly this target 18. And coming to the main goal, first one is eradicate extreme poverty and hunger. As I told before itself, this is the first target, mainly eradication of target and poverty and hunger. Okay. Next, poverty gap ratio, as we have discussed earlier itself, the ratio must be decreased in under 3-year and under 5-year children. Like this, they have set a goals. Next, target 2. This is repetition. Between 1990 to 2050, the proportion of the people who suffer from hunger we must be eradicate under 3 years as well as under 5 years also. According to NHFS estimates, the proportion of underweight children has declined by 3 percentage points during 1998 and to 1999, from about 43% up to 40%. Okay. These are all the MDG2. Goal 2 I told, achieve universal primary education. That is nothing but secondary education, primary education, as well as the gender equality. The disparity must be eliminated. So these are all the national health goals and Millennium Development Goals were setting by the different countries. Okay. Thank you all.